You are entering the cosmos. Hello, good evening, everybody. Hi, How are you?
I'm super.
You've had an interesting day.
I've had an interesting day.
She
But
continues to produce behind the scenes and in front of the scenes, and she continues to do what she needs to do regardless of the surrounding circumstances. So
that's right.
that
You
is
do what you
pretty
gotta
amazing.
do. You do what you gotta do.
Do what you gotta
Which
do.
is a segue into the person we're about to meet.
Yes, it is. Absolutely.
So it's Tanya Nichodom, and she is a superhero. First of all, just to be clear, she has been diagnosed with the same illness I have, systemic sclerosis, scleroderma. And we're going to talk about medical gaslighting and the length of time and what she went through. This is an educated woman who's done research medically. Like she's a
Yep. Mhm.
published, it, she's got a lot to say. I really like her. I fell down the rabbit hole of her YouTube last night. She's amazing. She's funny and smart and not afraid to stand up for what she believes in. And it's just such a big issue. I feel like we keep wanting to dive deeper into it, and this was a perfect opportunity.
Oh, yeah, this is absolutely perfect. So I know that so many people are gonna get so much out of this conversation. There are so many people who are dealing with medical gaslighting and hadn't even heard of it. So we're
Yeah.
connecting people to those truths to help people to empower themselves. If you're in a medical situation or if somebody that you love is undergoing some kind of a chronic illness or any illness at all, learning how to advocate for yourself and understand what your rights are is very empowering to connect you to your healing journey.
Yeah. It's a long road, and you just have to be, well, we're going to talk about it, but there's a lot of roadblocks around the way, and at least this is a way we can help maybe a few people
Mhm.
hurdle over some of those, like, yeah, that's a no, time to move on type of deal, right? So
Exactly,
that's the
exactly.
hope with journeys. We always like to have a bring a little hope or, understanding to people. So I think this will be
Exactly.
pretty powerful.
Yeah, and, you prepared a video that we can share. Do you wanna share that now before we bring Tanya on?
Yeah, that's fine. This is a video she shared on her TikTok, and it's actually the first video I saw of her,
Mhm.
and it's very powerful. It's powerful.
Okay, let's watch.
And they're like, it's not lupus, it's not MS, it's not rheumatoid arthritis. We don't know what it is. So I ordered a new one. And he says, there's nothing wrong with you. It's all in your head. It's all in your head. You need a therapist. So I go to my therapist, and I'm exhausted, and I'm tired, and I'm fucking hurting, and nobody's listening. And I find this new rheumatologist, and she's like, you've lost so much weight. Why is your skin tight? Why do you not have loose skin? This doesn't make sense. Your skin is too tight. But I'm not showing the markers for scleroderma. So they ruled it out. She's like, I want to send you to Mayo. I said, they can't do anything at Mayo. I've been turned down 3 times for Mayo. Mayo said they can't help me. So she said, let's just repeat everything. Let's repeat all the blood work, and this time do a skin biopsy. Okay, fine. So I go to my dermatologist, and he's like, it's not going to show anything. I have scleroderma patients. You don't look like them. It's not going to show up. Just run the biopsy. The biopsy came back positive today. 15 years. It took 15 years to get an answer. And he's like, I'm so sorry, because this can be a death sentence. And he's like, I'm so sorry. I said, I'm not. I feel validated. I feel seen after 15 years of being gaslit and mocked. So now I have a name for what's been killing me.
Wow. How does that resonate with you, being on a similar journey?
Well, it hit me like a ton of bricks, and I, connected with her. But I hear this so many times. We hear
Right,
this so often, and there's just so much that we can talk about. But, you know, I was the same 15 years between when I first got sick and when I got diagnosed with scleroderma. The problem
right,
is, for me, 10 years of that I was misdiagnosed and treated
right,
for multiple sclerosis. So my journey's a little different. However, all the treatments I did were actually counterproductive to what I have. But
right.
I can understand doctors look at you sort of odd when you first say, like, when they give you a diagnosis, a definitive diagnosis, like you're
Mhm.
supposed to be devastated.
Right,
And it is a devastating diagnosis, but you've known for 15 years something's not right. And now
right.
you have something you can fight, you can educate yourself
Exactly.
on.
Your enemy has a
You can
name
make
and there's a game plan, there's a strategy. It's empowering at the same time as being devastating, but it's empowering because you
right.
have hope that you can actually tackle it, perhaps.
And you can educate yourself and research and reach
Right.
out to people and make better choices, personal choices for yourself when it comes to your
Mhm.
treatment.
Exactly.
Before that, you're just being herded from one test to another
Yeah.
test, to having your symptoms treated, to being told it's all in your head, to being
Yeah, that's the thing that really
uh,
drives me
but we're
crazy.
going to talk about that because she's been through all of it too. So
Yeah, let's bring Tanya up to talk about it. Thank you so much for being here, Tanya.
Hello.
hi, Tanya.
Hi.
So that was a lot
Yeah, it's
to start off with.
you know, the craziest thing is this is nothing new. This happens to women everywhere, and predominantly women. Um, and it's been an ongoing thing. I mean, for years. I just got into contact with my dad is one of 16. Okay, so he's got a very large family, very large, diverse family, and he has nieces and nephews who are like older than him. It's a whole complex thing. Well, my niece, my cousin, uh, was in town because her father is in the hospital, and she said, my mother died when I was 17 from ovarian cancer because they said there was nothing wrong with her. And my dad says, well, she never took care of herself. I said, she probably did. She probably begged for help,
Yeah.
and they told her there was nothing wrong with her. And she ended up, by the time they caught it, it was stage 4, and it was too late. And this was 50 years ago. 50 years ago that this woman was ignored.
Mhm.
And this is something that just women in general have experienced. I remember at 21, I had some pelvic pain. I was having pelvic pain, and it took 7 OBGYNs, 7,
Wow.
before I finally found one who did an exploratory. And he goes, oh my God. He goes, not only do you have cervical cancer, right? Early on, they said, no, just leave it alone and we'll watch it. Uh, you don't watch cancer. What are
Yeah.
you going to wait till it gets bigger? So that's what they wanted to do. They wanted it to become big enough for them to be able to like make some money off of. They didn't want to catch it early. 7 doctors later, I finally had an exploratory, and he goes, you have pelvic inflammatory disease. You have polycystic ovarian syndrome. He's like, how are you walking? And I said, I'm not. And that's why I'm here. I begged 7 doctors to listen to me, and it finally took one. And if it wasn't for him, I probably, A, wouldn't be alive. and B, wouldn't have been able to have a child. I mean, and this was when I was 21, and I knew something was wrong, but nobody's going to take a 20-year-old. And they're like, no. And I told him, I said, there's pain during relations. And he goes, you just have to grin and bear it and get over it. And I'm like, I'm like, so men don't understand. I literally had one doctor, he gave me a shot of Valium in the butt. And he said, quit being a pathetic woman looking for attention.
What?
I was like, what now? And he gave me Valium in the office, a shot of Valium in the office. And then he goes, now go home. I'm like, you want me to drive? You just drugged me. And it was just the absolute insanity that I have experienced. I've seen 7 neurologists before finally somebody said, maybe you need to see a rheumatologist. I mean, just the obstacles we have to jump through. And this is why a lot of patients, give up and just wait to die. I can't express how frustrating it is. I have a condition also called suicide disease. This is terrible. Because of the scleroderma, we now know that it's because of the scleroderma. The nerves in the back of my skull are being crushed. The connective tissue is so dense and it puts pressure on the nerves. So the occipital nerves that run around the back of my skull and into my face, the trigeminal nerves and the occipital nerves, are being crushed. And so it creates occipital and trigeminal neuralgia. These diseases are so hard to treat because they want to treat you for migraines, but it's not migraines. And basically, they just throw meds at you. When nothing works, they go, well, we can't help you. And then you go home and you unalive yourself.
Right.
People commit suicide. This is why they call it suicide disease, because there's no treatment, there's no hope. And it's so hard to diagnose. And it's all just because nobody takes you seriously. Mm-hmm. And right. I think what set me apart from being so adamant with these doctors is I worked in the medical field. When I was younger, I was in my early 20s. I was an autopsy assistant. I worked in pathology, so I was around like surgeons and specialists, and I saw the worst case scenario. I saw the most obscure things that like 1 in a million things, and I saw the cause and effect. And I thought to myself, how does somebody wait for a tumor to get this big before they do anything? Because they're not being listened to. They're not being listened to.
Right. And there's something you had pointed out that your markers didn't signal anything specific. So I just want to say that with scleroderma, along with many, a multitude of autoimmune illnesses, but scleroderma specifically, they look for like certain things within your lab reports, within your test results, but there's no definitive test.
Exactly.
So it's kind of a process of elimination. Now, when they finally did the correct test, I did have the ANA and all that came back.
Yeah.
Everything, my antrocentromeres, everything was like off the charts. So they were like, my lab test said scleroderma. But that was 15 years from the day I said, I just tripped running for the 3rd time.
Right.
And I never hurt myself. Why am I falling? What's
right.
going on? And so that's when you say that there is no markers, I just wanted to clarify that that's what we're talking about.
Yeah.
There's not a specific, you can't just take a test and go, oh, you have it. Like,
yeah, and that's the funny thing is like my blood work is so, is considered benign. I mean, it's really considered like light. It's considered like light, but my pain is so severe. And even my pain doctors were like, I don't understand this. And the pain doctors I've had 77, this is terrible, 77 spinal procedures with my pain management doctors. And what they do is they go in and they use radio frequency sound waves and heat to ablate and kill the nerves. Well, those nerves do grow back, but if I can't feel the nerve, I can't feel the pain. So they can, the collagen can crush the nerve all at once. I'm not going to feel it. And that's the only treatment or therapy that has given me any relief. And he would go in to do this procedure, and he's like, I can't get the needle through your skin. He's like, he goes, I've had a doctor doing trigger points bend needles. I mean, I give myself B12 shots, and there's times where I can't get the needle in. And I'm like, it's a crazy thing. My markers are all like lower level. I mean, so when you get the blood work, you go, something's not right, but it's nothing dramatic that says, oh, it's definitely this or that. So they were saying, well, it might be rheumatoid, it might be this, but you don't really seem that bad. You look pretty good. I said, looks are deceiving. I said, I mask really well because, I'm from a generation. I'm from
what are we gonna do?
Right. I'm from a generation too, where it was like, you don't complain. You just, pull yourself up and push through and, don't complain. Don't acknowledge. Don't breathe life to your pain. Just like if you ignore it, it'll go away kind of thing. And it wasn't going away. And I was doing the same thing. I was tripping. I was losing coordination in my hands. Last night, I dropped a cup. I have sippy cups because I drop things so often. And they kept, I got disability from work and they were like, oh, well, they tested me and they're like, oh, you can still work. And I'm like, my hands don't work. And I worked in laboratories where everything has to be fine motor skills. And I'm handling hazardous materials and carcinogens and, like biological waste. And I'm like, if my hands are like this one day, I can't work.
It's hard for people to understand. Maybe we should have explained a little bit what scleroderma was. And
So just give a general layout for people who don't.
And the other thing is, I can be fine today, and tomorrow be like this.
Yes.
I can be fine today and not be able to walk at all tomorrow.
It's like yesterday, I had rehearsal last night. We had auditions for a new player, and we were just and I was I was sorry.
You are a musician, correct?
Yeah. And we were having stuff, and everything was fine until that last song, and my back started to seize up, and I was like, okay, I think we're done.
Yeah.
And I went and like all day today, I've been in bed. Mm-hmm. All day, like so. You do this thing where you chronically ill people call it spoons, and it's this allocation of spoons. It's like when you're out of spoons because you can't eat soup with a fork. Right. So you have to like ration your spoons. Don't we? Yeah. Oh yeah. We do. And that's the thing is like it's the production of too much collagen is basically what scleroderma is. Your body makes too much collagen and it causes things to constrict, to contract, puts pressure on nerves, blood vessels. It can affect your heart, your lungs. So far, mine hasn't really progressed in the last 6 years that we've kind of been hinting at this is what it is, when we knew something was really wrong in the rheumatoid thing. So it hasn't progressed much over like the 6 years that I've been really hyper aware of what this possibly is. But so I am considered one of the lucky ones, but there are days where like I literally wake up and I'm like, I do physical therapy 3 times a week. And there's like, we have storms roll in. When the storms roll in, forget it. I check out. It's a Netflix and chill kind of day. Don't ask me to function.
I live in Maine, so winter for me, I am pretty much a hermit. Because
I'm in Los
Angeles.
Yeah.
I just can't do it.
See, and I think I noticed this when I was in my 20s when I lived in Nebraska. I noticed like in the wintertime, my fingers would do this and I couldn't put my key in my car. And I was like, this is really weird. And I could never it felt like maybe my hands are just cold and I'm not warming enough. But when I moved to Vegas, everything got better. And I had a good couple of years of no problems because it's so unimaginably hot here. I mean, we get 120 in the shade sometimes. And when the monsoons hit, which is what we're having right now, it's every other day. I'm up, I'm down, I'm up, I'm down. And it really messes with you. So it's an overproduction of collagen. There's no way to remedy it. Hey, the great thing is, I have very few wrinkles. I'll take it. You got to find the hidden gems.
You do. You have
in the crappy hand that you're dealt sometimes. Because if you don't, you'll curl up in a ball and you'll cry. I mean, you literally will.
Some of the funnest, happiest people I know, genuine, real, organic, genuine people, are the ones that have a chronic illness. Because
Yeah, I think
we know what our days are numbered. Like today, I'm going to
yes,
cram as much in as I can because I'm feeling pretty good.
right,
I might not feel good for another week, or I might have 3 or 4 good days, or like, and we just don't know our time frame, which nobody
exactly.
really does. So you just got to put that in perspective. But what most people have is at least some sort of a guarantee or a hope that they're going to have a good quality of life until
Yeah,
life ends. Whereas we
yeah.
know this is not going to last forever. There is no
No,
cure. We will have ups and downs, and eventually we're going to hit downs and not come out of that down. So
yeah.
it doesn't,
You you
you just do what you got to do.
you look at life differently, and time passes differently for you.
Years of
Also,
yes.
I have noticed that because when I first started noticing problems, my son was little. He was about 3 or 4. And he just graduated high school. And I was sitting at graduation and I was thinking to myself, where did the time go?
Yeah.
It flew by. I literally sat there and I was going through pictures and I was like, I don't remember. I don't remember taking these pictures. I know I took the pictures, but I don't remember this time period. Your body like blocks out stuff because it's so traumatic and painful.
I'm here. I'm here. I don't
Okay.
know what happened to my camera.
Your body like blocks out lumps of time, and I don't know if that's like a trauma response or if your mind is just so fixated on trying to make it day to day that your short-term memories and your long-term memories just like shot. It's
But
a really
it's a full-time
weird.
job.
It is. I tell people all the time, they're like, well, what do you do now that you're disabled? I'm like, I am a full-time patient.
I
I
stay
am
alive.
literally, yeah, I'm literally a full-time patient. My job is to make sure my meds are filled, my appointments are on time, my specialists are seen. Um, the disability that I get, I am on Social Security now because there was a lot of like some of these disorders don't qualify you for Social
Right.
Security or disability, but when they mess up, and give you secondary conditions, that can lead to disability. So because they treated me wrong for so long and they just kept pumping me full of steroids, I have a condition called avascular necrosis, which means both hips and both knees, the bones are rotting and dying. It's terrible from the inside out. And the only cure for that is to have them replaced. But because I'm 46, they don't want to do that. They're like, "You're too young. Let's see if we
Yeah.
can wait a little longer." And I told them honestly, I said, "It's painful when it flares." I said,
Right.
but I said, I think I can push through for a couple more years. And I do, but I make sure I do everything like physical therapy, watching what I eat, taking all these supplements to like help my immune system, to help my inflammatory response, just to function, just so that I can have more good days than bad days. And it is literally a full-time job. My husband was like, "What is this bill from Amazon?" I'm like, "That's my supplements. That's the stuff that allows me to
It
get
is
in and out of
actually a
bed.
full-time job.
That allows me to keep my appointments, to and now that my son is, a fully functioning adult now, I feel like I can take a breath,
Right.
um, but it's still, I mean, my job is making sure I stay on top of my surgical procedures, making sure I stay on top of my supplements, my meds, my physical therapy. I mean, I have to go into him tomorrow, and I'm like, "Listen, we got to work on this part of my body because this part's doing better, but now this part is acting up, and I'm
Yeah.
experiencing, pain." And it's a full-time job just surviving.
It is.
And nobody thinks of it. They're like, "Well, but what do you do?" And I'm like, I struggle to live.
Speaking
That's
of
what I
things
do.
that happen when you have an autoimmune, one of my
Right.
least favorite things for somebody to say to me, which I'm sure you've heard, is, "I wish I could stay home all day."
Oh my God. I get that all the time.
Okay,
Oh, well,
let's trade places.
I wish I could just live off of my spouse and I'm
Yeah,
like, and I feel bad because there's days my husband comes home and he's like, "Hey, how'd you do? How was today?" And I'm like, "I'm still in my pajamas. It's 4 p.m. I'm still in my pajamas." And I'm like, "Yeah, I took my meds and I laid here. I physically laid here and I struggled to get myself to the bathroom."
yeah,
When my son was a young age, he would bring me juice boxes and Lunchables because I physically couldn't make it to the kitchen. I
yeah.
mean, he was doing that at like
Scleroderma can leave
4
you
years old.
with. They always let's. I want to talk about the gaslighting a little bit. So
Yes.
I can tell you that your story resonated with me. One of your TikToks, you talked about seeing the rheumatologist, and he said you definitely don't have it. You know, you need to go see.
Yeah.
The first rheumatologist I saw that they sent me to, before my doctor thought I had MS. So I go to the neurology. The first, she says, I don't think it's MS. I think we need to send you to rheumatology. And she sent me to rheumatology, and the rheumatologist said, I don't even need to look at you. You don't have it. I can see it in your face. You don't have the red dots. You don't. And he's like, really?
Right.
And he's like, so I don't need to do anything. It's just a waste of time. And I'm like, okay. He knows more than I do at this point, right?
Yeah.
Because this is my first experiences with all this.
And you
So then,
trust them because they're the professionals.
yeah. So years later, I got treated for MS for 10 years,
Mm.
mistakenly. So years later, when they started questioning it, they wanted to send me back to the rheumatologist. And guess who they sent me to? Same guy. And guess what he
Yeah.
said? I told you before there's nothing wrong with you.
Right.
I'm like, well, for
Right.
10 years, they've been treating me for MS because there's so much wrong with me, with my
Right.
labs and my MRIs and, the scarring and the fibrosis. I'm like, and he's like, no, it's not what it is. And then I got a lot happened in between, but I ended up getting sent to Boston to a rare
The
disease special team. And they were like, yeah, you're, all
the
we had to do was
the
the labs. That was it.
oh yeah,
All we had to do was the rheumatology panel. And,
the
and
things that are said, the things that are said to you.
what is it?
I went to a neurologist for the occipital neuralgia. I was like, there's got to be something that can be done. This is before I was seeing my pain doctor. And I was like, because I had it because my other doctor was like, I've seen this before, and this is all textbook occipital. He's like, you need a neuro because they're going to get in there and do something, either remove the nerve or what have you. I went to this neuro, and I brought him my chart, and I had my chart in my hand, and I handed it to him. He didn't open it. He looked at me and he goes, "You got headaches." He goes, "It's migraines. Women get migraines." I
Women
go,
get
"No, I said, "I have occipital neuralgia." And he goes, "No, you don't." I go, "Are you going to open my chart or are you going to line your bird cage with it, sir?" I said, and he goes, "I don't think I can make you happy." He didn't even order a test, didn't even touch me. I'm sitting there in a gown. I don't know why I need to be naked at a neuro. And I'm sitting there and I'm going, I said, "I don't think you're going to be able to make me happy either. So I tell you what, I'm not going to pay my copay and I'm going to leave right now." And I took my chart and I was like, I didn't want to see him. I wanted to see his partner. Um, and there was a reason. There was a reason I didn't want. I just had a feeling about this guy. I just had a feeling. And then I went to a new rheumatologist, and he was like, he looked at me, squeezed my hands twice, and he goes, "Nah, you ain't got nothing." I'm like, you didn't look at any of my blood work, my previous blood work, my new blood work. You didn't order any blood work. You didn't ask me my medical history. You squeezed my hands. Okay. I said, you can't tell people have cancer by looking at them. You can't tell people have AIDS by looking at them. People have hidden illnesses.
yeah.
And
Scleroderma, let's face it, in 15 years, you
it's,
could have died.
oh yeah. It
I
could
was
have
close
progressed.
to
I am
dying
so
when I
lucky.
got
Yeah.
diagnosed. So
Yeah.
it's a
And
big
the
deal.
one doctor was like, "Listen, when I finally found this rheumatologist that I have now, and she finally got the skin biopsy. The skin biopsy was a clincher because it's not showing up in my lungs. I've had lung scans. I've had CT scans and everything. I've seen a cardiologist. Everything looks great, but I have this horrible nerve pain. But I've been to neurologists, and they're like, all the nerve studies have come back. Yeah, it's fine." Um, So he's like, she's like, something's off. But it took her ordering that biopsy. And even the dermatologist was like, nah, you don't have it. He goes, you don't have that puckered face. You don't have the tightness. And I'm like, yeah, I think it's just really in my skin layers. I said, I don't think it's involving my organs. I don't think it's involving my heart. I said, but I think it's just in my dermal layer. I said, really, like in my skin and around my nerves. How do we check for that? And that's when she was like, the biopsy, let's do that skin biopsy. And he was shocked. He was like, I never in a million years thought this was going to come back positive, because I thought, we're going to rule this out. She's probably got something like inflammatory rheumatoid something, it comes and goes, kind of an arthritis thing. And that's what they were treating me for. But when I saw this rheumatologist, she sat me down and she's like, listen, this can be a very terrible thing, but you haven't progressed in a few years. So that gives me hope. And I said, I'm very optimistic about this, because I have my good days and bad days, but I don't seem to be like progressing. Like I have a couple friends with MS, and they've progressed over the years. I'm still kind of where I am. It's bad, but it's not getting worse.
That's very good though. But you said you were on some meds that are compatible either way. They would have been.
Yeah. So the first thing they did was they put me on hydroxychloroquine. They're like, if it's rheumatoid, if it's sclera, this is the first line of defense. We're going to try that. And I did that for about 5 or 6 years, and it worked for a while, but then it started to not work. And I thought, maybe we're progressing. And so I went and saw this lady, and she's like, listen, you have 2 options at this point. She's like, you have methotrexate, and I hope to God you tolerate it. I was like, why? She goes, because the only other option is chemotherapy. And I went, oh, I really, really don't want that, lady. I said, well, let's just cross our fingers. And and so far I'm a couple months into it, and so far I haven't noticed any benefit, but I haven't noticed any problems. So I'm weaning off one and trying to up the other one. And so far I seem to be tolerating it. And that with my anti-inflammatories and all of my other stuff that I do, I seem to kind of be weathering the storm. And I told him, I said, listen, my pain doctor says, listen, this is never going to get better. He's like, all we want to do is keep you from getting worse.
Which is really all they can do with sclerosis.
And then I said, listen, I'll take it. I said, I will take it. I will take, rationing my good days, if you can just give me some semblance of hope. But when you go to these doctors and you're like, I think something's wrong. I went to a doctor one time, and this is when they diagnosed me with like having fibro. This is when they first knew something was off, because I was hurting all the time and I had no explanation for why I was hurting all the time. This was like early on. And the doctor came in and he says, I said, I really hurt. I think I'm coming down with the flu. I said, everything hurts. And he goes, no, I think you're bipolar. I went, what? How do you go from the flu to and I went, what? So he doses me up on Seroquel. I have a nervous breakdown. I collapse at work, and I don't know where I'm at. I don't know who the people are around me. I start hallucinating on the starter dose of this like titration series. And my husband was like, what are you doing? And I said, I went in for back pain and joint pain. And he said he gave me an antipsychotic. And I was like,
I want to come back up for a second. I want to talk about things that doctors have said to us. So my husband got sick, and that's a whole other show when your caregiver.
Oh yeah.
What happens when your caregiver gets sick? But he was at the center where he was being treated, and they said to him, one of his doctors said to him, and this just happened within the last year. One of the doctors said to him, we're going to figure it out, David. We're going to figure it out, because we know you need to get back to work. You're the man at the house.
Right.
Nobody in 15 years, 20 now,
Right.
not one doctor, one specialist, one nurse has ever
yes.
been concerned with my career or
Yeah.
my ability to bring money into the home.
Of getting
Right.
you mobile again, of getting
Never.
you back on your horse. It's all about when the man has a problem, and thank God, because we want David to be very healthy. Okay.
Right.
But
Right.
it's the idea that the man is much more important. When a man says he's in pain, he
He's
gets
also
more
never been
attention.
told he needs a therapist.
No,
Oh,
they're not.
never.
When they're in pain, they're in pain. When we're in pain, we're crazy or we're being babyish about it, right? It's a double standard, and it takes women so much longer to be
I
authentically
have
and
a statistic
accurately.
on that.
Yeah,
It's 4 years. It takes
4
women
years longer.
an average of 4 years longer to get a diagnosis than a man with the same illness.
And illnesses that
Yes.
affect
4
women
years.
disproportionately, and illnesses that tend to be women's diseases are much, they get less research, they get less funding. There's just less attention on it. It's almost like, and I think it was Venus Williams, it might have been her sister, but she had a blood clot after she gave birth in the hospital. And she wrote an op-ed that all these other famous people, famous women were talking about having happened to them too after birth. Williams had to actually force the hospital to give her the proper tests and attention, or she would have died. She had to advocate for herself. So she writes this op-ed and she says, I am so famous and wealthy and influential. Can you imagine what women who are not
Yes.
my status have to go through? She was shocked. Because she's a woman, they just sort of, say, oh, you're just making stuff up. You have to advocate
Things I've
for
heard it.
yourself.
Like I said, I never heard when I had to stop working. It was, and I told my doctor, I'm literally going to have to quit my job because I can't remember. I worked on the ambulance and in the ER, and I couldn't recall stuff fast enough.
Mm-hmm.
Yeah.
I'm going to hurt somebody. I cannot hold things how I should be able to, and I can't recall stuff. And the doctor said to me, don't you have teenagers? What does that have to do with
How
anything?
is that relevant?
Right.
You have teenagers. Yeah, I do. Will that cause me to drop stuff? I mean, I didn't know that was a symptom of being the mother of a
You
teenager.
you talk about how like men get like acknowledged so much faster. I have a friend of mine. A male friend of mine, who was diagnosed with fibromyalgia. Do you know how quickly he got a diagnosis? I mean, it took me years. It took me years, and I was given an antidepressant.
Mm-hmm.
I was given an antidepressant and told to just quit complaining. He was diagnosed within the span of like 3 or 4 months and had a treatment program and everything. He was given front line to the Cleveland Clinic. They're like, we got to rule all this stuff out. We got to get you going. And then he comes back and he goes, I've been diagnosed with fibromyalgia. And I was like, okay, and he's like, they didn't stop until they found out. And I was like, yeah, my fibro diagnosis took me a good 12 years.
Yeah, 12
And
years.
15 doctors.
Yeah, and I was given he's like, oh, I'm given muscle relaxers and anti-inflammatories, and I'm given physical therapy and muscle stripping and myofascial release and trigger points. And I'm like, I was given Prozac and told to quit complaining.
Right.
Everybody hurts. Everybody gets cramps. Everybody.
And when the men get that attention, it proves that the system can operate much more.
Right.
It's proof that they have these resources. They have the attention. They care. They just are not giving equal services to women.
And sometimes men don't know they're being gaslit.
Right.
So like my father, for instance, my father has been healthy as a horse like his whole life until later years, until I would say when he was about mid-50s, he started having, like a little bit of weight gain and diabetes and, stuff like that. But he'll go to his doctor and he'll be like, no, my doctor said, and I'm like, your doctor put you on 2 medicines that you should not be on together. You need to say something to him. No, my doctor knows. My doctor knows. Your doctor is going to kill you. You're on 2 competing medications that you should not be on for a type 2 diabetic.
Mm-hmm.
I'm like, you're gonna ruin your kidneys. No, my doctor knows everything. And then I send him to a new doctor, and he's like, yeah, my new diabetes doctor said this doctor could have killed me. you've got to be aware, because listen, these doctors are humans. They are just people. They
And
make mistakes.
They're practicing.
That's why you call it practicing it. That's what I mean. Everything is a practice. I mean, there is no perfection. And he was like completely, like my mom, I had to like beg her to see a different doctor, because the two of them were like, no, our doctor knows best. I'm like, your doctor's got you on insulin and an anti-insulin. And I'm like, from my medical knowledge, I'm like, this causes renal failure. Hey, my kidneys aren't doing good all of a sudden. I told you. You know?
So we're all right around Gen X, all three of us.
Yes.
And I think we're the first generation that actually started questioning doctors.
Questioning authority and really saying,
they were like, they trusted everything their doctor said.
Yes.
We only had to see one doctor back in my day.
And my son is Gen Z. And let me tell you, these kids question everything. They question authority, the government.
They brought them up to do it.
They question even science. They're like, is that a legitimate study? And I'm like, and they go through, and I'm like, there's nothing. I'm going to tell you, my kid, he's almost 19. There's no BS in this kid. He's ever since he was like 4, he saw right through you.
Mm-hmm.
I mean, and we've taught them, and I think it's because we're dealing with our trauma and trying to save our generation, the next generation, from our trauma. So we love them a little bit more. We validate their emotional health and their mental health. So that's why there's such a surge in like mental health, taking care of yourself. Self-care is such a big thing you see. We never did that. I mean, if you try to tell your boomers, if you try to tell a boomer, you need some self-care. Well, what's that? You need to relax. So I don't have time to relax. I've got to work. I've got to, and Gen X was, that's what my dad says all the time. I'll rest when I'm dead. And I'm like, you got one foot there, buddy. You better take a break.
Take a breather.
But it's
crazy. You have to advocate for yourself. You do.
You
have to be well informed. This whole thing with authority that we're trying to get over, like you said, Gen Z is getting over it. Gen X is sort of put that ball in motion. I remember the Stanley Milgram experiment that was, in the 60s, where they had people in lab coats telling other people who were subjects to, administer electric shock. And it was all simulated, but the subjects did not know that. And because the people were in white coats telling them to administer electric shocks, they proved it. And it was on the heels of World War II. And basically the idea was they wanted to prove that anybody, it's not just the Nazis who would be taking orders from people in white coats. It's that anybody can be susceptible.
Right.
So you have to, and when we're talking about the medical system, the doctors are under stress. They have like 3 to 6 minutes per patient. They don't have time to sit there and be medically curious. It's not like back in the days of old where a doctor, the country doctor, would come and really try to analyze something. They're in, they're out. It's like, McDonald's. You're just going through a drive-through and you're just and you're getting 2 different doctors have 2 different opinions. So if all doctors are correct, who are you going to choose?
Well, and when you find a good doctor, I had a great doctor. He was a geneticist. He was brilliant. But he said the red tape drove him out of business. Yeah, he became a concierge doctor because he goes, I'm not getting reimbursed. He goes, I'm not being reimbursed. They want me to see so many patients an hour. I can't give them quality care. He's like, I'm failing my patients. I'm referring people out. He's like, I'm hiring PAs to take stuff. He goes, I haven't paid myself in 3 years. Yeah. He goes, I'm barely making enough to cover my staff. And he had a small office, but he's like, I can't. He goes, this isn't sustainable. The way the healthcare industry is, it's a money-making organization. It's capitalism. It's based on capitalism and not socialism, which is care, and general care for your fellow human. So you're seeing this monetary thing that if you have enough money, or if you're persistent and, a pain in the ass enough, you'll get your stuff validated and you'll get acknowledged and you'll get care. And I feel bad for people who do that blind obedience and say, my doctor knows what's best. You know, I mean, I went into one doctor and I was like, listen, I think my diabetes is out of control. I want to try this new medication because I just keep gaining weight and I know that's not good for me. And he goes, nah, you just need to stop eating bread. I was like, dude, I don't eat at all.
Wow.
You know? And I said, what do you mean eating bread? I said, I work out 5 times a week. I'm in physical therapy 3 times a week. And I go, and I'm gaining weight. And it's not muscle. I'm gaining like around the midsection. So I went to his partner and I said, listen, my diabetes, he's like, do you want Ozempic? And I was like, let's try it because my meds are not working and I'm spiraling. My kidney function was like going downhill. And I did the Monjaro is what I did and lost 35 pounds. This is the healthiest I have ever been. This is the most stable I've ever been. My kidneys, my liver, my diabetes is all like almost in remission. It's almost, I mean, I'm not even diabetic on paper anymore, but if I go off it, I am again. But I mean, it's finding the one doctor that's going to listen to you. So you got to keep being persistent until you find the one that you can kind of see. And that's why I love my doctor, Ken. He's a nurse practitioner. He's a young guy. He's like maybe 40, maybe. And he's young. It's fresh in his mind. And he loves a challenge and a puzzle. And so when I came into him, I was like, listen, I got a laundry list of crap. And we're just going to start following strings back until we take care of it. And he's like, we'll unknot this mess. And we've made so much progress in the past, like 4 years I've been seeing him. And this is the most progress I've had in like my 15-year span of like, you know, trying to track down the right person, the right response. So just to feel seen and listened to.
Yeah, a good doctor saves lives. A good doctor is
right.
weight in gold or her weight in gold. Yeah.
Yeah. You just
They really are.
acknowledge you, right? Like just validate that you're
Yes.
a human being in front of them. I'm not that test result you're reading. I am a human being with a life, with a family, with people who depend on her, with things I need to be doing, and I can't do them.
Right.
Help me.
And I went in.
And they're like, go see your therapist.
Yeah. And I told him, when I went into Ken, I said, listen, I have 2 therapists. Okay. I said, I have the one I go to and I just talk about my feelings and I vent. It's like having a buddy that in fact, I told her, she's like, we should just be friends and forget this whole thing. You know, she goes, cause we hit it off so well. And she doesn't see a lot of patients. She owns the business, but she goes, I kept you because I get just as much out of these sessions as you do.
That's
and then I have my therapist, for meds. And I said, listen, I have a good support system. I have a good support system and support staff and everything. And I said, but here's what I'm having problems with. My meds are not right. And I need you to regulate my meds. And when I went to him about the weight gain, I said, listen, the more I weigh, the worse my diabetes gets. My diabetes is very contingent upon where my weight stands. If I can keep my weight where it needs to be, I'm not diabetic. But it's a hormonal thing, and it's a residual from my PCOS, my hormone imbalance, my endocrine system just being out of whack. And he's like, let's regulate those hormones. Let's regulate those chemicals. He got it regulated. And listen, I'm essentially cured as long as I stay on my regimen.
Right.
But this other guy, his thought was, you're just chubby. And I said, listen, it's not about me wanting to be skinny. I'm not expected to be a model. I just don't want to be diabetic to the point where I lose my toes or my kidneys. Because I have family members who that's happened to. They've ignored it. They've said, oh, it's not a big deal. And then they end up losing a limb, losing a kidney, and never recovering. I was like, I'm not going to do that at 40 something. I learned really young that life is short. I lost my aunt, a very close aunt to me. She, like 7 days after her 40th birthday, she died from breast cancer. And this was back in the 80s, late 80s, when they thought, we'll remove the breast tissue, no more breast cancer. Well, they didn't take the lymph nodes, it spread, and she left 3 young children behind, like 3 very young children.
So horrible.
And I remember saying to myself, don't let somebody put you in that position where you're so trusting that you give up all power. And that's what it is you're giving up your own power, your power over your own body and your own decisions. So when a doctor says, well, I want you to do this, and you're not comfortable with it, you find another doctor.
Yeah.
You
know,
make
and
a
It's
comment.
not fair to
They
make
wanna
friends
hear,
with your doctor or to have your doctor like you. I think a lot of people
yes,
impress their doctor or be a good patient.
yes.
I'll do anything you say without actually analyzing whether it's good for you. If you poll 100 different doctors about the same thing, which a lot of us have been to multiple doctors,
yes,
you're going to get a different answer. So don't be obsequious. You have to stand up for yourself. The same thing with mental health professionals or whatever. There's a lot of people who went to one therapist and didn't like it and they never tried again. I say,
right.
it's not about that one professional. That professional is not indicative of everybody who's out there. So you have to stand up for yourself. You have to come well informed, take notes, and also just be very confident that you know your body. Your body is speaking to you. Do not let somebody in a white coat tell you to do something that actually could end up getting you killed. And it does happen every day.
And I think our generation was also told to we were like, I'm a textbook people pleaser. I'm a firstborn. I'm Gen X. I've got that ADD. I probably have a touch of the tism. So I'm a people pleaser. I'm a yes, okay, sure. And I will be a good girl and I will do what you say. And I think that's why it took me so long to get angry,
Right.
And to find my own power until I finally had a doctor just gaslight me so bad that everything flashed back to the doctors in my 20s, the doctors in my 30s. And I just snapped one day and I went, these people are going to kill me if I don't speak up. I mean, I literally had doctors giving me meds that killed Heath Ledger. And they're like, take all of these. Mm-hmm. And I'm like, I thank God I knew enough about medicine and I knew enough about science that I was like, I can't take these three things together. I will die.
Didn't.
When you're a pain patient, I had a doctor give me 40 milligrams of OxyContin and 15 of morphine a day. And I was literally bedridden. And he's like, that's all I can do for you. And I was like, you're literally trying to put me down. This is euthanasia at this point. Yeah. This is euthanasia. I woke up. Yeah, I woke up and I was like, I gotta do something. I gotta get mad. And I found another doctor and I went in and I went to a neurosurgeon. I said, do something. I don't care if you cut something out of me. If you put something in, you gotta make this. There's gotta be another option. And he's like, I can't, but this guy can. And he helped me find the right people in the right places to do the right things. And that set my journey of really standing up for myself and saying, listen, this is just a person.
Right.
This is just a person. And they may not be seeing the picture from my perspective. So I got to find somebody who's willing to slip in my shoes for a second, have an out-of-body experience and say, what does this person need? What can we do? And I'm so glad that I finally found people that, and I'm that way now. Like when I go to a doctor, if I don't like the front office staff, if I don't like the vibe, I do a vibe check, from the first phone call. When I go in there, before I even walk back there, you got to check off a checklist. And if you do anything, I've walked out of offices before I've even signed in. I was like, nope, not doing this. Absolutely not. So you get, I think it's the PTSD that kicks in and it forces you to have this. And I want to share that with other people. So you have a vibe check, have a checklist that says, if this doctor says these things to me, if the office makes me feel because in essence, this is a capitalist society. Those people work for you. Yeah. I'm paying you to help me. And if I don't feel you're helping me, I don't have to. It's no different than somebody who's cutting your lawn or trimming your trees. If you don't like the way the guy trims your trees or cuts your hair, you don't go back to that guy.
Yeah.
You don't go, well, she's trying her best. And I've got this lopsided haircut. And I go back there 7-8 times with burned roots and, a bad dye job. You don't do that. So why do we do that with doctors? Why do we allow them a pass? And I think it's because we see them as experts and authority figures. And we're taught as young children, don't question police, don't question priests, don't question doctors. And we should. We should, because they're just
We
people.
should question everything. I think one of the
Yes.
other things I wanted to point out was you said about being a people pleaser and all that. One of the things that I pointed out when I first had my like, what is happening here? Like, I need to reel this in and get control of it. Was you're fucking desperate.
Yes.
You're desperate.
Yes.
You're in so
Yes.
much pain. You know you're dying. Like in your head, you're
Yes.
like, no, I'm like dying. Like I'm not
Hmm.
exaggerating. Either I'm
No.
completely unaware of a huge mental health issue, which you all want me to believe, but you can't
Right.
fucking say it,
Right.
or I'm physically dying. Every day something's being taken from me and I have to live in this torture chamber that is my
Yeah.
body. And all I want you to do is help me fix it, or at least
Mhm.
get it to a level I can
Exactly.
function. You're
You
so
go down this.
desperate.
You go down this rabbit hole of believing you're crazy, being told you're crazy so many times that you start to believe it. It got so bad that I went to my therapist and I was like, seriously, do I need to be committed? And she's like, no. She's like, you're not harming yourself. And I said, I'm so stressed out. And she says, you don't have mental health issues. You have a physical medical condition that is draining you and making you depressed. You don't have depression on its own. You have
Yeah,
depression because you hurt 99% of the time. She goes,
being
that will
gaslit.
drive anybody crazy.
I
And
was just
I
gonna
think,
say, being gaslit so many times,
oh, yeah.
you end up with a mental health issue. You end up with
Well, yeah.
medical
Exactly.
PTSD.
Yeah.
I
So
literally was in
basically,
front of
they
the
have
mirror
given
going,
you another diagnosis.
yeah, I literally sat in front of the mirror going, I think you're crazy. Maybe. And I was talking to myself and I'm going, now you're
Okay.
talking to yourself. But they drive you down this path of questioning your own sanity to the point where I did put myself into a place and I was like, something's wrong and I don't want to live anymore. And they're like, yeah, you're in chronic pain. You're being mistreated, mismanaged, misdiagnosed. And I found a really good therapist at that clinic, and that's who started my journey into finding a good therapist. He's like, you're not any of these things. You have a medical condition that has been neglected so long that you believe you're crazy for feeling the way you do, because everybody has told you there's nothing wrong. And he goes, there clearly is. And I mean, he passed away a few years back. I wish he was still alive so that he would be able to see, I told you, I knew there was something there. We just had to keep digging. He's like, you're going to find the right doctor and it's all going to make sense. And my old rheumatologist, I would go in and I was like, listen, he goes, you have all the signs, but none of the definitive, things. So he was like calling it CREST, which is what they call it in the beginning, scleroderma,
Yeah.
they call it in the beginning. And he says, you just need one more symptom before it's like a clincher for me. Before it's like, he goes, what? He goes, you're going to wake up one day and something's going to happen and it's just the light's going to turn on and it's all going to make sense and we're going to know. And it did. I went into his office and I was like, hey, this is new.
Yeah.
I said, I woke up and my hand, he goes, huh. And I go, yeah, this is new. I can't open my hands. He goes, well, how'd you get here? And I said, well, I drove like this. And I said, I probably shouldn't have. I said, but
You do
I'm
what you gotta
desperate,
do.
dude. I said, I'm desperate. And I said, but I can't. I said, I woke up, trying to straighten my hands and I could only do this. And my son kept going, he goes, what is this, Lady Gaga? What's going on? And he was teasing me. And I was like, I don't know. I can't straighten my hands. And he's like, yeah. And he goes, but then it went away because when we started treating it with meds, it went away. And he's like, okay, maybe you don't have it. Well, maybe we were suppressing it. And he's like, and he was somebody who had practiced rheumatology for 50 years.
Wow.
And he was right on the edge of it. He just retired. That's why I found the female rheumatologist. But he was like, listen, we're going to call it this. And I was stable. I was so stable for so long with him. And then he said, listen, I'm just going to retire. He says, let your regular doctor maintain your meds. You're doing good. If it gets worse, find a new rheumatologist. Here's a list. He gave me well, of course, within 3 months, it got worse. The 3 months of this guy retiring, it got worse. I called that list. Nobody was taking new patients. To find a capable physician or good healthcare in Las Vegas is a nightmare. I can find a slot machine faster than I can find somebody qualified to to tell me, oh, and I can get any medication I want at a dispensary within seconds delivered to my door, but I can't find a doctor.
Right.
I can't find a physician. Like when you're critical, and I go to an ER, there's one ER in town I can go to that I have not been labeled as attention seeking. That takes me seriously, because you go in as a pain patient. Yeah, yes, you go in as a pain patient. You're like, listen, I'm in critical pain. I can't. And they're like, sure you are. I had a flare up at this one hospital. I was curled up in a ball. It was at a convention center. I had a attack of inflammatory colitis, and I doubled over. They had to call paramedics. I was stuck in the bathroom. It was so embarrassing. It's a convention of all my peers. And I'm like, oh my God, this is embarrassing. And I get taken to the ER, and the lady looks at me, and she figures out where I came from. I came from Mandalay Bay, which is a convention center, but it's also a casino. She goes, did you party too hard? I go, no, I must have eaten something, and now my colitis is flaring up. I'm like, she thought she treated me like I was drunk. And that's the thing, is like in Vegas, a lot of the times they treat you, they hydrate you and they give you a Tylenol. They go, yeah, you just need to sleep it off. No. This is dehydration. This is colitis. And they don't listen to you because they're so used to the influx of just the traffic that they get.
Blinders on. I mean, I work in the emergency room, so I've seen the blinders, but I think it helped me when I got sick, because when I go to the emergency room,
you know
I look
what
at
to
the
say.
doctor and I say, I need you to you're not taking anything, my blood pressure, nothing, until you go talk to my doctor.
Yeah.
Or read my chart.
Mm-hmm.
Then come in and talk to me. And it's always a different demeanor. The nurses are different. The doctor's different. It's a whole different ballgame, because I'm very tiny. And so what do they think I'm there for? I must be on drugs. I must be an addict, right?
I had a doctor. I had a doctor do that to me, gaslit. He goes, he kept looking at my arms. He's looking between my toes, and I go, what are you looking for? And he goes, do you shoot horse? And I go, what? And this is when I was heavier. This is when I was at my heaviest. And I said, and I'm sitting there like this. I go, sir, I believe I have spinal meningitis.
Oh my God.
Because I couldn't turn my head, and I had a fever, and I couldn't turn my head. And I knew from my medical background, oh God, this is meningitis, get to an ER. And he goes, nah, I think you're on heroin. And I went, I can't turn my head. And I looked at him point blank, like nose to nose. I said, come here. And I got real close to his face. I go, if I was on heroin, don't you think I'd be a lot thinner, buddy? I said, because I was pretty robust. And he's like, and he looked at me, and I said, I have meningitis. He wanted to do a cavity search.
Oh, geez.
Well, and to be honest,
kid you not.
If you are an addict, if you are,
I still deserve care.
Unstable, you still deserve.
I still deserve care.
You could be both. You could be both. It's not like
he literally pulled my pants down and left the room. And the nurse came in, and I'm like half naked. I'm crying. I'm freezing. I'm in pain. And the nurse goes, baby girl, why are your pants around your ankles? And I said, he said I needed this. And she goes, he goes, no, sweetheart. He goes, you need a spinal tap. You got the meningitis. And that's when they moved me into isolation, because the nurse knew, but the doctor wouldn't believe us. The doctor would. And it was like, you're a slave to this guy with this credential, because he's the one who makes the decision, who checks the box that says, if you essentially live or die. And so we play this game with convincing yourself you're not crazy. Don't look too crazy. Don't look too needy. But you better look sick, but don't look too sick, like you're looking for attention. But in order to get your point across, in order to get the care that you, deserve as a human being and desperately are in need of, it's just, I didn't realize how bad my town was until I moved here. I came from Omaha, which was a very med-centric town. There's tons of med schools, tons of medical centers. It's the center for transplants. And then I came here where nobody cares. And it's really weird.
It's different, huh?
It's very different. To find a doctor in Vegas was,
and I think you said that a lot of them, like the average age for doctors. Didn't you do a TikTok on that as well? Like they're old, like retirement age,
Yeah,
they're
yeah. A
older.
lot. Most of the
Yeah.
rheumatologists are on the edge of retiring, and we're not getting a lot of new ones in that field for some reason. A lot of doctors, listen, they go where the money is, and I don't blame them. So a lot of them are going. You're seeing an influx of orthopedics. I get it, pays well, stable, and you're seeing a lot of pain management doctors, but you're not seeing a lot of like obscure specialties that are going to take a lot more work. Like a rheumatologist, that's highly specialized, and that takes a brain who's going to look at this giant umbrella and be able to
Yeah.
find in that umbrella, where do you fit? Because these disorders are a spectrum.
Right.
I mean, if you try to find an autism specialist, it's hard because nobody really goes into it. Fewer and fewer people go into it because it's such a vast field that it's like, this is too big for me to like break off a piece of it. So they highly specialize. So we're not seeing people who take these broad positions. We're seeing less internists. They're like, you need an internal med. Dude, if I can find a family practice, dude, I'm good to go. I mean, just trying to find a general. I mean, luckily I found a good clinic, and it's kind of been like my secret that I keep in my pocket, that I feel like I have a trench coat with like secret stuff. And when I meet other chronically ill people, I'm like, hey, I got a list of doctors for you. You need a doctor? I got a doctor for you. But so people call me all the time. People contact me on TikTok. They're like, hey, who do you see for this? You live in this area. Who do you see? I'm like, yeah, let me check my Rolodex, And I take out my little trench coat and I'm like, I got a guy. I know a guy. And that's what Vegas is. Vegas is you have to know somebody because it's such a transient town that doctors come, they try to establish a practice, they can't, and then they go home. They go back to their small town. They go, forget it. I'll just do it back home. And so we lose a lot of people. There's doctors I've had appointments for, and I go and I go there and they're like, oh no, the doctor quit a month ago. What? Nobody called me. Oh yeah, he moved home. Clinic shut down. I'm like, that's patient abandonment. You got to notify your patients.
Well, and that's a total trigger for PTSD.
Oh yes.
Having that whole search, you start to feel that anxiety. I got to find another doctor. I'm going to have to go through this all again. They're going to want to do all their own tests. They're going to ask me all the questions. I got to look like I don't want to look too put together, but I don't want to be disheveled.
Right.
I can't be crazy when I'm rambling off my 19 diagnosis or more. And
I was talking to my therapist about that exact thing, like having to look put together. Because she goes, listen, every time I see you, she goes, I write down my notes. And she goes, and I send that into the insurance company. And she goes, I got to tell you, a lot of mental patients come disheveled, they're disorganized, they're unkept, they're, unclean, because they're so depressed that they're forgetting their basic things. And that gives them a gradient of like how bad you are. And I told her, I said, I do this thing where I like dress up for my doctors. And she's like, and I said, because here's the thing. I figure like if I look professional, they'll take me more seriously. And so no matter how bad I feel, I like put on a cute outfit. Because it does make me feel a little better. It kind of like, I'm like.
I do the same thing for medical appointments too. I do.
Right?
You want to be on an equal playing field.
Right. I put my best foot forward so that, because I don't want to look too crazy. I don't want to look too desperate. I don't want to look too sick. And then I go in and, I'm put together, and my therapist is always like, why you always seem well put together. I said, I push myself to, because I've been disregarded when I look less than. Like when I go in, like when I've had a 3-day stint of, throwing up horribly, I'm being in bed for 3 days and my hair is a mess and, my eyes are swollen. And I go to the ER, they're like, yeah, but if I go in and it looks like I'm a clean cut professional, oh, wow, she's got a real problem here. She's in a real pickle. It's like, now you take me seriously?
Yeah.
But it's sad that we feel like we have to do that to begin with.
We put on a show. We put on a show to try to, right. Just so that we're seen, so that we're taken seriously, and we're not treated like, oh, this is somebody off the street looking for a fix.
Right.
No, I'm a woman who's been in bed for 4 days. I haven't been able to keep food down. I don't know where I'm at. I don't know what day it is anymore. I'm sweating through my clothes. You know, I'm absolutely miserable, but let me put on my mascara. God, let me draw my eyebrows in, because I swear to God.
It's another gender discrepancy. I don't think that men are.
No, I think it's a thing women do, because I think if we look put together, we're taken more seriously.
Right. We're always fighting for someone to take us seriously, whether it's in the field or somewhere else. So
and this goes back.
Against
this goes back like generations. I mean, if you look at what was invented for women with hysteria. I mean,
Yeah.
well,
we talk about the boomers, but most of our mothers were taking happy pills, right?
Exactly.
Mama happy. If mama ain't happy, nobody's happy, but we're drugging mom, you know?
Some young girl said, they were talking about the difference in the generations, and well, in my generation, a wife could afford to stay home and take care of the children, and the house was clean, and the food was made, and she was dressed. She was on drugs. She was drunk as a skunk by 3 p.m. She was on so many uppers. She wasn't eating. She was smoking 2 packs a day. All to keep this mystique. And people were like, well, my mother used to be able to, my mother kept a house. Why can't you keep a house? Your mother was on uppers, because
they had nothing else.
Right. You had, you weren't, you were like chained to that stove. You literally were. And it's this thing with like the difference in generations, and the difference of like, and I said, they're like, oh, if we could just go back to the good old days. I said, yeah, I wish cocaine was in my Coke too.
Right? Exactly.
I'm sure I'd be a size 2 and my house will be clean too.
I wear my pearls every day with my glass of Coke.
I'd be like, well, hell, I scrub the floors and now I can smell colors. You wouldn't care. You wouldn't care that your back hurts.
And we talk about generations a lot. We actually just did a show on generations, but people don't realize that it wasn't that long ago that women couldn't have bank accounts and stuff. Like my mom's generation couldn't have
only
their bank
50 years.
accounts.
Yeah.
And
it's only
my
been 50
mom's
years.
generation also, and my grandmother especially, their husbands could call their doctors to get them medication.
Yes. Or get them cut off.
Really being a whatever, I don't know what's going on with her. She needs something, and boom, the doctor write you a prescription without even seeing you.
How many confident, outspoken women were silenced by lobotomies? I mean, how many confident, strong-willed women were seriously like just taken out? But I mean, look at the Kennedys. The one Kennedy, she was the rebel. She didn't conform to their image, so they lobotomized her, and she was a vegetable the rest of her existence. I mean, they used to be able to. And it wasn't that long ago. I'm 46. When my father was in his 40s, so it wasn't that long ago. He went to get a vasectomy, and my mom had to sign papers that gave permission, because this is the way it was. And then when I went to have my hysterectomy, I had to have so many visits from my therapist. I had to be evaluated several times. I had to see these other doctors several times, and I had to I had to go through marital. My counsel said, we're not doing that. She's like, we're absolutely not doing that. But my husband scheduled his vasectomy, and then literally was like, called that day. She's like, well, we can get you in tomorrow. No questions asked. But women have a whole different set of rules than men do. And they still do that. Like when I went to get my hysterectomy, they were like, are you sure? Are you sure? And I was like, it's nobody's decision but mine. I'm like, I am literally.
It should be that way, but now we're rolling back all those rights. My
husband always jokes.
Than I had.
Right. My husband always jokes. He goes, no matter what the Supreme Court says, I don't own you. He says, I don't. He's like, so you want to do something, you just. He's like, all I ask is that you clue me in. Hey, I'm going to go do this. Okay. He goes, so that I know what's going on. He's like, I don't need to give you permission. Just,
Yeah.
But it's crazy. I mean, my mom couldn't go on birth control without her husband's permission back in the 70s. Couldn't go off it without her husband's permission. Well, have you talked to your husband about this? She's like, forget my husband. This is my body. She's like, I don't want no more kids.
Yeah.
He's like, well, you really need to consult your husband. She goes, I don't need to consult nothing. You know, and it really took, I think, the dawn of women doctors, you know, becoming more mainstream and women standing up for other women. And then you see in politics, a lot of women are siding with the men, and I'll never understand voting against your own interests, but I see it all the time.
Yeah.
And it's just, we're taking so many steps back, and it really makes me fearful for the next round of people who are going through what I'm going through and not getting answers. Are they going to be listened to? Are they going to believe? Is it going to take the next person 15 years? And if my trauma can save one more person from having to go through 15 years of absolute hell, then my trauma was worth it. And then it served a greater purpose, and I can live with what I went through if I can. And that's why I think I've been so outspoken about it, is because it's like, don't let this happen to you. You know, pound your fists on the table, stand up and scream, make a scene. You know, my mom always told me, she's like, don't let people abuse you. You know, she was always worried about us girls getting, you know, sexually harassed or abused. She's like, you stop whatever's happening and you make a scene. She says, if somebody tries to grab you, you make a scene. And so that's the lesson I've taken into, you know, my medical experiences. If I'm not being listened to, make a scene, throw a fit. I've walked out of doctor's offices screaming, I will see you in court. And I've cleared out waiting rooms because I've had doctors who I needed a skin graft one time after an accident. And the guy told me it was nothing wrong with me. I could just go back to work. And I had an open infection. And I was like, I worked in a micro lab. I was like, you want me to go work around bacteria with an open wound? That makes no sense. And so he wouldn't take me seriously. So I made a scene in his office until I got removed from his care and into the care of a different person who took me seriously then. And I made a full recovery, but I would have lost like function of my arm had I stayed with this guy. I mean, sometimes it takes being a nasty woman to get shit done. It just
I don't think we're nasty though. I think if a man speaks loudly and a man is like,
he's assertive.
No, I'm not doing this.
But when a woman does it, she's just a bitch.
She's crazy. Yep. It's in your chart.
Mm-hmm.
Oh, look, somebody else already wrote it. But anyways, we've gone way over, and I apologize. But I find this fascinating. I love this topic because it's so many people I hear from every day.
Yeah.
One of the things I just wanted to bring up, and then Renee, whatever you have left, is the fact that most studies, even today, most studies are done with male participants. Yes. So there's not a lot of study on women. Like there's not a lot of studies on scleroderma and how it affects a woman's body. Every treatment we're getting, every prescription we're getting is all based on studies using male anatomy.
Yes, I had to understand the clitoris. I mean, there's
they know, right?
The clitoris.
I had so much problem with scar tissue after having my son, a C-section scar tissue, that it infiltrated like and they didn't know why, and it's because of the scleroderma. But I mean, there's no research into, you know, I mean, they still don't know what causes endometriosis. They think they might, but I mean, nobody's really studying these things.
No,
they're like, it's just women.
Yeah, it's just a women's condition thing. Don't worry about it.
It's just women pain. All women have pain.
Clitoris,
right.
Renee? Who cares about the clitoris?
It's a myth. It's a myth. It's like Pluto. It doesn't really exist. It might. We don't know. Nobody's really seen it.
We don't know. No one's ever seen it.
We'll wait for the older men in the history books to let us know.
Right.
And I have to say, my rheumatologist today is a man, and he is phenomenal.
Yeah,
awesome.
So I don't want it to seem like we're bashing men.
No, definitely not.
Statistically.
Yeah.
It's just statistically they don't put the same amount of effort in, and that's unfair.
Right.
We could do a whole show just on that too, because that's
I know.
endemic.
Well, we know who to call when we do
We
women's
know who
rights
to call
next
when we
time.
Tanya.
Definitely.
Thank you, Tanya, for
Thank you.
being here. You've shared so much. You're so educated. You're so articulate. Your story is just so impactful. So I know you're going to help a lot of people to, empower them to really stick up for themselves when they're going and trying to get treatment, to not give up and to make sure
Yeah.
that their needs are first and foremost when you come on in.
Yeah.
No people pleasing, no doctor pleasing. It's all about you. You could lose your life. So you have to just remember to advocate for yourself and for your loved ones. If you have a loved one who is kind of, not wanting to go up against the grain, go in there with them, help them to stand up to a doctor who might not really have the time or have the interest to really get to the bottom of things. So thank you so much for being here. Thank you for the viewers.
Thank you for having me.
We love you, Tanya. Stay in touch. We will
Definitely.
anytime we want to talk about these issues,
And
come
people
back
can
on.
follow her on TikTok.
Yeah.
It's in the description.
It's in the description. Follow her on TikTok.
It's hilarious.
Comment.
I have another page too that's just all fun. There's nothing heavy on that page. It's Bandit the Cockatoo. It's just my parrot, and it's this bird that chases my husband. He's got 155,000 followers. It's gone viral.
Yeah.
It's the craziest thing. I keep that real, like, just parrot centric. So like I have a lot of children and people follow me, just for that. But yeah, it's crazy. It's a TikTok has like really connected me with so many people, and I've been able to share so many different facets of life. And I think it's made this world a little smaller, and it's made it a little, I feel the world a little smaller, and I feel my circle a little bigger. And I feel like we're helping more people, and we're reaching more people, and we're sharing stuff so that now people are becoming more and more empowered. The more we share, the more it helps somebody.
Absolutely.
And I really believe that these new apps are really fostering that. People say, "Oh, it's bad. It's bad for you." Oh, it's addictive. Don't get me wrong, but it's also helped so many people. It's made so many people not feel alone. And if that's the one thing I can do.
You definitely exemplify that, and you are helping people to get educated and to stand up for themselves, which is like fantastic. It's information sharing, and you're right, it's connecting people to other people who might be dealing with the same things. Back in the day, if you go back pre-internet, if you had something going on with you, really it was just the people that you knew face to face.
Right.
They weren't going through that or whatever, you would have no idea. So now it's kind of opened up. It's a little bit like the Wild Wild West, but it's also a lot of information sharing, and that can be very healthy. And
the way that information spreads so quickly now. I mean, we're seeing things, we're seeing change happen in real time, like in front of us. It's with the whole Roe v. Wade thing, when that went down, I watched it affect so many people, and so many people rise up together, so many different people and different generations, and it affected so many people, that the outreach and the instant sense of community and unity that these apps can foster is just amazing. I mean, I really think people discount what good these things can do by making your world a little smaller.
Exactly.
I just wanted to say one more thing. You had brought up on the same lines of TikTok, mental illness and how it's more prevalent, and how you didn't think it was so much more prevalent. I agree. I don't think it's more prevalent. I think we just taught our children, and they're teaching their children.
Yes.
It's okay to say I need help. So more people are coming forward.
That's what
they're saying, I need help. They're not just going to work every day with a smile on their face and going home and curling up in a ball because they just have nothing
heal
left.
in a holistic way. Heal from the outside.
When I was looking at a career path, back in the day, back in the early 90s, nobody really went into mental health. Nobody went into psychology. It was like it was a degree you got when you didn't know what you wanted to do. And it was a degree that you really couldn't do anything with. And that was back in the day. We've put such a priority on mental health that my son has been like, when he first started saying, "Mama, I'm not happy. I'm very sad all the time." When he was little, I noticed his ADD and his depression and his OCD. And I was like, I got to get this kid some help, because I don't want this kid doing what I did, hiding, crying in a closet, thinking there's something wrong with me. So I got him help right away. And guess what? He's going into therapy. That's his career path. He's got it all laid out. He wants to be a therapist who works with teenagers and depressed teenagers and music therapy and just mental health, because they've put such a priority on it that, you know, when he comes to me, when he was in high school, he'd come to me, he's like, listen, I need a mental health day. I'm so stressed out. I'm so, you know, and I let him have that. And I saw he did better. And he's so much more well-rounded and well-regulated than I ever was. I was 14 on
Oh, we weren't
Zoloft
allowed
and
to
a
talk.
mental mess. Right. We were not allowed to talk about it. My mom was like, she needs a medication. Medicate her
Children
so
are
she stops
seen, not
complaining.
heard.
Exactly. And now we put such a priority on, like, you know, speak up, say something, tell me what you need, and let me make your life easier. And I think every parent wants that for their child. They just want them to not have to go through the things that they did and have a better life, have all the things that they didn't have.
Right.
And so we put a high priority on that. And I've really seen a change in the generations, and it really has me hopeful that it won't take somebody else 15 years to get diagnosed.
Amen. Your your words. Let's hope that it happens. I mean, I think that's why we do journeys. We want to, you know,
Right.
we want to use people's stories who are willing to share their journey and their story to help others maybe not go through the same thing, or maybe connect with somebody who can
Yes.
help them, who knows
Right.
somebody else, you know, that sort of thing.
Mhm.
Like we we're not all going to change the world, but we can all do
Yeah.
something. Can all
All
do
do
something.
something. Yep, all hands on deck, you know, just we have to, and community, when you were talking about social media and
Yeah.
stuff,
Yeah.
there is power in community. There is
There
power,
is.
you know, in all of us combining our voices and coming together and just sharing these narratives, sharing these stories, so that people know that they're not alone, that they're not just the only person who's had to go through that. And
Yeah.
that in and of itself really is a confidence builder when you're going in and you have to advocate for your own journey, to say, I have an army standing behind me who
Yes.
is wishing me well and supporting me and helping me and, you know, troubleshooting this together. So you really stand for that. And that's why I hope everybody goes and follows you on TikTok and stays abreast of your journey. And we will just keep staying connected. And thank you, everyone, for
Yeah. You know where to find me. I'm easy to get a hold of usually.
All right. Well, thank you, everybody, for coming out. And thank you again to Tanya
Thanks
and
for having
Jen
me.
for setting this all up. We just, you know, and Replay Squad, hello. Live
We have an
audience,
interview
hello.
tomorrow.
We have it. Yep. So tomorrow is it 7:30 or is it 8? I think it's
I
7:30.
think it's at 5 our time.
Oh,
No,
5
wait,
o'clock. 5 o'clock is our
5
new
our time,
show.
right? We've
Yep.
had to do this like 3 times because we got the time zones mixed up.
Yeah, so this is Max Chester, who's a trans advocate, and he's going to be here sharing his story tomorrow. Yes,
Yes.
you're right, 5 p.m. tomorrow Eastern. So we will see everybody there, and have a good evening, everyone. Thank you for
Thank
tuning in.
you.